So the first thing I would do is check the order with the MAR, and this is my MAR, and I would look to see if my patient has any allergies or when the last dose was given, if this was an as-needed medication, and I would look at the drug reference sheet to see if there's anything I need to know about this medication that I may not know already, and I would calculate the correct amount to give. So since this is insulin, they do have a correction scale as well, and my patient's blood glucose is at 7.9 right now, and so with supper, since it's 17:15 and they do have their tray with them, they're scheduled for 4 units of rapid-acting insulin bolus. And since their blood glucose is 7.9 on the correction scale, they don't need any extra units added. And so now is where I would do my first check since I calculated how much I'm to give. So let's say this was my insulin. I would compare the medication to the MAR and make sure it's correct, make sure it's not expired or anything like that. And then I would prepare the medication. I'm going to start by performing hand hygiene. And I would make sure I have chosen the right needle gauge and length and the correct syringe as well. And I would do my second check. So comparing again to the MAR, making sure that everything is right. And if it was from a vial, I would clean the top. If I was using an ampule, I would make sure I have a filter needle, making sure just using the correct procedure. And so now I would open my needle safely. And I would safely remove the cap and draw up 4 units of air since I am administering 4 units of the insulin. And the middle, flip it upside down and inject the air into the vial. And then draw up carefully the 4 units. And then I would remove any air bubbles that are present. I can use a pen. Okay, and then safely remove and recap the needle using one hand. And then I would perform my third check with the MAR, and now I would ask for an independent double check from a different nurse. And I would provide her with all the information and see if she came to the same dose that I did and see if I drew it up correctly. Now we're in the patient's room, and I would introduce myself and I would identify the patient using 2 identifiers. I would ask them for their name and date of birth, and I would compare it to the MAR here. And then I would ask them if they have any allergies, and I would ask them if there's anything that they need to know, and I would kind of see what they know about the medication. And something important here is that they eat when I inject the insulin. So whether I give it to them with their first bite of their meal or right before they eat, regardless, it should be given with food. Now I would provide privacy by closing the door or curtain, and I would position the client how I needed them. So for landmarking, you would go about 2 inches or 5 centimeters away from the umbilicus on the abdomen. Anywhere in any of the 4 quadrants of the abdomen is preferred, or you can do the back of the arm, the back of the leg, sort of anywhere that has a lot of fat. And then, so I would assess the patient, I would position them, I would landmark, and then I would assess the skin integrity, and I would palpate for any tenderness and just make sure that the site is good for injection. So now I'm going to don my clean gloves. And then I would clean the site. So let's say I'm doing an area on the abdomen. So you clean in a spiral motion going outwards about 5 centimeters. And then I can safely remove the cap of my needle and pinch the skin to sort of raise that fat, and then I will quickly dart the needle at either 90 degrees or 45 degrees depending on the area, and slowly inject. And I would leave the needle there, making sure not to aspirate for about 5 to 10 seconds, and I would remove and release, and I can apply some light pressure with a cotton pad or the alcohol swab, and then I would safely recap the needle, or I would put the safety on the needle, but since I'm going to be reusing the needle for practicing purposes, I would just recap it. So after disposing of the needle safely and taking off my gloves, I would perform hand hygiene, and then I would go and I would document the site of which I administered the insulin and the exact time that I did, and then I would return later to check on the patient and make sure that it was effective, and I'd be looking for any signs of hyperglycemia or even hypoglycemia depending on what I'm looking for. And so hypoglycemia is identified by blood sugar of less than 4 millimoles per liter, and hyperglycemia is when your blood sugar is greater than 7. So you're just keeping that in mind whenever you check their blood sugar before you administer the insulin. And you would do that before every time you administer insulin, just to sort of know exactly how much you're supposed to be giving. You would never guess or anything like that. You always have to check their blood sugar first.